Hello, my name is Taiba Hussain and today I will discuss about mental health and inequalities. Mental health inequalities mean that some people have better access to mental health care than others because of factors such as poverty, where they live, their ethnicity, gender, or age. This topic is very important because everyone should have equal access to support and treatment. So, uh, there are some things like what are mental health inequalities and main causes of the mental health inequalities, impact on people and societies, and ways to reduce inequalities. So in this presentation we will discuss inequalities and why they matter. I will discuss the main causes, for example, poverty, education, and housing. I will also explain how these inequalities affect individual and communities. Finally, I will discuss about some ways to NHS and government can reduce these inequalities. So there are some social factors such as poverty, poor housing, and low education, unemployment. So some groups are more affected. For example, young people, older adults, ethnicity, minority communities, and the effects are delayed treatment, poor physical and mental health, lower quality of life. So, mental health inequalities happen when some people find it harder to get help and when they need. People living in poverty or poor housing often experience more stress and anxiety, unemployment, and low levels of education can also increase the risk of mental health problems. So different groups are affected in different ways. For example, young people may struggle with anxiety and depression, while people from ethnic minority backgrounds can face barriers such as language differences, discrimination, or stigma. Older adults may experience loneliness or isolation, which can also affect their mental health. So these inequalities can lead to delayed treatment and uh, uh, poor health and lower quality of life. To reduce these inequalities, the NHS health professionals should improve access to services, increase awareness, provide early support, and ensure everyone receive fair and equal care regardless of their background. Thank you.
Hello, my name is Amira Fiona Riveredo and my topic is key issues that causes mental health inequalities. One of the major issues that affect the mental health is poverty. People with low income can face financial stress, unemployment, meeting daily needs such as good living condition and food. People living in poverty usually struggle to meet their basic needs and persistently worried about their bills, debts, and stress about choosing between essential, for example, eat or heat, especially during winters. It increases the pressure on them to meet their financial needs so that they can afford basic necessities. This increases the risk of anxiety, depression, and other mental health conditions. Keys issue that causes mental health inequalities. The other issue is education and employment. Good education improves knowledge, employment opportunities, and health literacy. It is provides better opportunities for better paying jobs. However, the growing job market competition can make it even worse as the higher expectation, strict qualification, and limited vacancies can create pressure to constant upskill, fear of failure, stress during job search. This can lead to depression and lower self esteem. Unemployment can cause depression due to financial instability and anxiety about their future. Social withdrawal due to financial instability and lower self esteem. Workplace stress can also affect the mental health due to high workload, long hours, which can affect personal and social life. Thank you.
Hello, my name is Firdausia and today I'm going to talk about mental health in the United Kingdom. Mental health is an important part of overall health and well-being in the United Kingdom. Mental health problems affect people of all ages, backgrounds and communities. Although many people receive effective support, access to services and health outcomes are not equal. Understanding the current situation in the UK helps explain why reducing mental health inequalities is an important goal for health and social care services. Common mental health conditions. The most common mental health conditions in the UK include anxiety disorders and depression. Many people also experience stress, eating disorders, obsessive compulsive disorder, bipolar disorder, schizophrenia, and post-traumatic stress disorder. These conditions can affect daily life, relationships, education, and employment. Early diagnosis and treatment improve recovery and reduce the impact of illness. Mental health services in the UK. Mental health care is mainly provided through the National Health Service. People can receive support from general practitioners, community mental health teams, counselling services, hospitals and specialist services for children and young people. Charities and voluntary organisations also provide advice, emotional support and community programs. The aim is to provide person-centred care that meets individual needs and promotes recovery. Current challenges. Despite improvements in the UK, continues to face several challenges. Demand for mental health services can increase, leading to long waiting times in some areas. Some communities experience difficulties accessing care because of poverty, discrimination, language barriers, or limited local services. Workforce shortages and pressure on NHS resources also affect the quality of and speed of care. These challenges contribute to mental health inequalities across the country. Government and public health initiatives. The UK government and the NHS have introduced policies to improve mental health care. These include promoting early intervention, increasing community-based services, improving crisis support, and raising public awareness of mental health. Schools, workplaces, and local authorities also play an important role by encouraging well-being and reducing stigma, preventing mental illness, and supporting people early can improve long-term outcomes. Conclusion. Mental health remains a major public health issue in the UK. Although many services are available, unequal access and social disadvantages continue to affect outcomes for different groups. Improving access to care, reducing stigma, investing in community services, and addressing wider social factors are essential steps towards reducing mental health inequalities. Health and social care professionals have an important role in providing fair, respectful and person-centered care for everyone. Thank you.
Hi, my name is Petronella Aciobanite, and today I'm going to talk about the barriers to mental health support. So, barriers to mental health support are the obstacles that prevent people from accessing, receiving, or continuing mental health care and treatment. These barriers can be personal, social, cultural, or related to the healthcare system. There are some types of the barriers like stigma and discrimination, which is including fear of judgment, shame, or being treated differently. Negative or stereotypes about mental health conditions can stop from seeking help earlier. Then financial barriers, cost of mental health services, property, and employment can limit access support. Financial stress can increase to risk of mental health problems. Lack of awareness and education. People might not recognize the symptoms of mental health conditions. Limited knowledge about available services, misunderstanding and treatment options. Then another one is accessibility barriers, long waiting lists for mental health services, shortage of mental health professionals, limited services in rural or disadvantaged area. One more is cultural and language barriers, different cultural barriers about mental health, fear of stigma within communities, lack of interprets or culturally appropriate care. The last one, healthcare system barriers. It says difficulty in accessing referrals and appointments, lack of continuity care services might not meet the needs of all, and services needs of all groups equality. So the impact of the barriers are delayed access to the treatment, symptoms might become more severe, increased risk of crisis and hospitalization, greater mental health inequalities, and reduced qualities of life. So I'm going to say a conclusion about the mental health barriers. So barriers to mental health support to prevent many people from receiving the help they need. Stigma, financial difficulties, lack of awareness, and unequal access to services continue to contribute to mental health inequalities. Reducing these barriers requires accessibility, inclusive and culturally appropriate mental health services alongside greater awareness and support for all communities.
My name is Maria Cristina, and I'm going to talk about mental health in the UK and why some people don't get the same care. Mental health is very important because it affects how we think, feel, and live every day. There are many different mental health conditions, such as anxiety, depression, schizophrenia, and bipolar disorder. These conditions affect people in different ways, and some people need more support than others. Every person has different symptoms and different needs. That's why some people need more support than others, but not everyone gets the help they need. Mental health problems can affect people of any age, including children, adults, and older people. They can have an impact on relationships, work, education, and everyday life if the right support is not available. For example, people with anxiety or depression can ask for help, but people with schizophrenia or psychosis cannot always ask for help. Because of this, some people don't get the right care, and this can make their condition worse and affect their quality of life. Getting help early is very important because it can improve people's mental health and quality of life. It can also help people feel stronger and more confident. Early support can prevent mental health problems from become more serious and can reduce the need for emergency care later. Good mental health support can make a big difference in people's life. We need to make mental health services better and easier to access. Everyone should have the chance to get the right support when they need it. Thank you.
Hi, my name is Idrit Tufal. Today I'm talking about ongoing mental health challenges. Although mental health services in the UK have improved over the year, there are still several important challenges. One of the biggest issues in the growing demand for mental health services. More people are asking for help than ever before, which has resulted in long waiting time in many areas. Other challenges: unequal access to care, people living in poverty, those from ethnic minority communities, or people who facing language barriers and discrimination often find it hard to get the support they need in some areas. Local mental health services are also limited, making access even more difficult. In addition, the NHS is facing workforce shortage and increasing pressure on its resources. This means that some patients may not receive treatment as equally as they need. These challenges contribute to mental health inequalities across the UK, where some groups experience poor mental health outcome than others. In conclusion, mental health remains a major public health issue in the United Kingdom. Although many services and support systems are available, not everyone has equal access to them. Social factors such as poverty, discrimination, unemployment, and housing problems continue to affect people's mental health and create inequalities. To reduce these inequalities, it is important to improve access to mental health services, reduce stigma, invest in communities-based supports, and address the wide social cause of poor mental health. Health and social care professionals also play a key role, treating everyone with fairness, respect, and compassion while providing person-centered care that meets each individual needs. By working together, the government, the NHS, communities, and healthcare professionals can help create a fair mental health system and improve outcome from everyone.